Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Question: 35-year-old female is undergoing a surgery under general anesthesia, which shows that there is sudden raise in carbon dioxide levels are seen. Which of the following is not likely to cause? Okay. Raised CO2 levels. So whenever there is raised CO2 levels, first what can happen? Raised CO2 levels can happen in neuroleptic malignant syndrome. It can happen in malignant hyperthermia. It can happen in thyroid storm, but it cannot happen in anaphylaxis. So raised CO2 levels cannot be seen in anaphylaxis. It can be seen in neuroleptic malignant syndrome, malignant hyperthermia, and thyroid storm.
thank you and thank you for watching.